So welcome everyone to this session on creating a sustainable healthcare supply chain. My name is Arianna. I lead the sustainable procurement and circular healthcare work at Healthcare Without Harm Europe, and I will be the moderator for this session. It's the first time we're using the room, so I hope everything goes well. Otherwise, I kindly ask you to be patient. Before I introduce our speaker, I would like to invite all the participants to use the chat box in case you have any questions, and we will address them in the QA session at the end of all the presentations. So the outline for today, starting global, we have Susan Wilburn, International Sustainability Director for Healthcare Without Harm. She will set the scene by giving an overview of the power of procurement in driving transformational change in the healthcare sector. Susan manages the Sustainable Health in Procurement project called SHIP and coordinates the global green and healthy hospital technical areas on waste, chemicals, pharmaceuticals, and procurement. She also represents health sector civil society organizations on the Bureau of the International Conference on Chemical Management, the SICAM Bureau. Then, zooming into Europe, I will provide an overview of the new European Healthcare Market Transformation Network and how its working groups builds on the Healthcare Without Harm Europe's projects on disinfectants and plastic. So I will explain a bit what we would like to achieve through the activities of the working groups and how this links to the universal standard procurement criteria that are currently under development within the SHIP project, as mentioned this morning by the keynote speaker, Rosemary, and as Susan will explain later in her presentation. I will then give the floor to Oliver Slaughter, who is the Sustainability and Environmental Manager at Sussex NHS Foundation Trust. The Trust participates in the Towards Plastic-Free Healthcare in Europe project, led by Healthcare Without Harm Europe. And as part of his role, Oliver delivers a wide-ranging sustainability projects relating to waste management, circular economy, travel, and well-being. He will give an overview of the Trust action to reduce plastics and case studies on replacing dressing packs with individual items bought in bulk. And our last speaker was supposed to be Anders, but as you can see here, unfortunately, he could not make it today. So Anders is the chemist of Region Västra Götaland in Sweden, and he's also the chair of Healthcare Without Harm Europe board. He's part of the expert working group of Healthcare Without Harm Europe's project on disinfectants, SICAM 2.0. And he was invited today because he coordinates chemical management in the region from the perspective of health and environmental protection. And so his work is basically to set up and evaluating demands in procurement, educating employees about the safe management of hazardous chemicals. So as I said, unfortunately, Anders could not make it due to an urgent family matter. So we wish him and his family well. But I also would like to thank our colleague Dorota for kindly covering Anders' presentation today. Dorota is our chemicals policy and project officer, and she holds a PhD degree in biomedical sciences. Prior to joining Healthcare Without Harm Europe, Dorota worked at the European Commission's Joint Research Center and the Department of Public Health of the Catholic University Leuven in Belgium. So during the session, Dorota will share more information about the experience of Region Västra Götaland and lessons learned when replacing disinfectants with safer and effective products. As I said, we will conclude with the Q&A session after all the presentations. But before we dive into our topic, I'd like to give you a short introduction about who we are and what we do. For those of you who do not know us yet, Healthcare Without Harm Europe is an international NGO that brings the voice of healthcare professionals to the European policy debate, but it also raises awareness and inform the healthcare sector about the importance of the environment. Our vision and missions are to mobilize healthcare leaders and professionals to achieve a sustainable and healthy world by transforming the healthcare sector to protect public health and tackle climate change. In the European Office, our programmatic work promotes the sound management of chemicals, climate-smart healthcare, plant-based nutrition and food waste reduction. And we also look at the impact of pharmaceuticals on the environment and antimicrobial resistance. And as per topic of this session, we promote sustainable procurement practices to reduce the negative health and environmental impact of the products and services purchased by the healthcare sector. We work on these areas closely with our diverse network of more than 140 members and strategic partners across the European region. And they are hospitals, healthcare facilities, regional authorities, and environmental NGOs, to mention a few. All of this is part of the global network of green and healthy hospitals. I will not say more about the network because this will be covered by Susan, but I just would like to encourage the participants of this conference to join the community if you're not part of it yet. Now, without further ado, I let Susan talk more about our work on procurement at global level, and now she engages with the GHH network and benefits the network.
Thank you very much, Arianna, and many thanks to the conference for the participate today. I'm delighted to be with you. Again, my name is Susan Wilburn, and I'm the Sustainability Director for Healthcare Without Harm internationally. I'm going to talk today a little bit more about Healthcare Without Harm, although Arianna, I think, covered it very well. Why sustainability? We all know why, so that will be brief. And then what is procurement's strategic advantage in improving sustainability of healthcare services? I'll talk a bit, as you heard this morning from Rosemary Kumwenda, my partner from the UN Development Development Program. I'll speak a bit about the Sustainable Health and Procurement Progress Project, show you some of the successes globally and the impact also of the supply of the coronavirus, COVID-19, on the supply chain and what Healthcare Without Harm is doing to support our member hospitals in dealing with this pandemic globally. You saw the vision and goals of Healthcare Without Harm Europe and how they fit together with the international goals. I just highlight on this screen the major overarching goal. You can see protecting health from climate change and building leadership for environmental health. And the large words are for transforming the supply chain to establish and globalize procurement criteria so that we leverage healthcare's purchasing power to drive policies and markets for ethically produced, healthy, sustainable products and services. And like you, I look forward to hearing more and seeing the results of the market transformation work in Europe and how we can connect it to the work globally through the Global Green and Healthy Hospitals Network that Arianna has already spoken about. She spoke about the members in Europe of the GGHH, the Global Green and Healthy Hospitals, that represent over 10,000 hospitals and health centers. Globally, we have almost 1,400 members in 72 countries that represent the interests of over 44,000 hospitals. And just in the last 2 months, we have had 5 members from 5 new countries join us. So we're rapidly closing the boundaries of the map so that we are completely global. On this slide, you also see where Healthcare Without Harm has regional offices in Brussels, in Belgium for Europe, in Washington, D.C., and in Manila in the Philippines for the Asia Pacific region. We also, on this map, show red dots of strategic partners where you can see in Beijing, Kathmandu, New Delhi in India, Melbourne in Australia, Durban in South Africa, and Sao Paulo in Brazil. The Global Green and Healthy Hospitals has this agenda of 10 goals that you see across the middle top of the screen: leadership, chemicals, waste, energy, water, transportation, food, pharmaceuticals, buildings, and sustainable procurement on the bottom right of the goals. I have mapped the GGHH goals against 3 of the Sustainable Development Goals, the UN goals that were adopted in September now 5 years ago, with aim to completion in 2030. Goal 3, good health and well-being. And you can see the particular target here of reducing the number of deaths and illnesses from hazardous chemicals, air, water, and soil pollution, the subject of sustainability in healthcare settings. The Climate Action Goal 13, and the goal most related to sustainable purchasing or sustainable procurement is that of Goal 12, responsible consumption and production. Just one shot of what's happening to our planet and has been happening now, so that it is unavoidable to accept and admit that we have made a disservice of our planet and our climate. Not far from where I sit on the west coast of the United States, there are fires that are rapidly encroaching hospitals. This is a hospital on fire from 3 years ago in California. The same thing in the same area is happening again. We see hurricanes and typhoons that are not only destroying our communities, but destroying our health facilities, for which we must be resilient and the last building standing. It's quite personal for me, climate change. I live in a small boat that you can see in this photograph, and I am very, very sensitive to the changes in the tide from the sea level rise, that when a low tide occurs where I am, you can see the bottom of the ocean, and when it's high tide, I look over the pier that holds my dock in place. But equally important for thinking about the impact of our work on sustainability, you can see this shadow of one of my closest neighbors, the lovely great blue heron, which was endangered 25 years ago in the United States from the use of DDT, as was the US symbol, the bald eagle. And both of these birds have made a comeback as a result of the ban of DDT, now almost 50 years ago. Just shifting to think specifically about sustainability and climate in the health sector. As you know from this report published a year ago from Healthcare Without Harm and ARUP, that if healthcare were a country, it would be the 5th largest greenhouse gas emitter on the planet. And digging a little deeper into greenhouse gas emissions in 3 countries, China, India, and Indonesia, you see the proportion of scope 1 in blue, scope 2 in orange, and scope 3 in the gray, where each of these countries is 75 to over 80% of their greenhouse gas emissions are scope 3, which is largely from the supply chain. Another place for us, another opportunity to make a difference in sustainability through supply chain. This is data from 2012 from the National Health Service in England, and I was speaking earlier today with Oliver to say I know that he will have more up-to-date information. This slide is to show that in 2012, 65% of the carbon footprint of NHS England came from scope 3, and to further break down the scope 3 emissions from that data, you can see that the procurement of pharmaceuticals, business services, and biomedical devices are the major share of the supply chain related greenhouse gas emissions in NHS. And at the time, this represented 25% of the public sector greenhouse gas emissions in the country. What is sustainable procurement? We think of procurement, sustainable procurement, as preventive medicine that supports a high performance healing environment, attracts new opportunities, models leadership values to communities, patients, and employees, and often has the intended consequence of saving money. And you can see some of the facts about why environmentally preferable purchasing, which is how it is commonly known in some settings, is important to address in the efforts towards sustainable healthcare. That, as you saw in a previous slide, the health sector represents almost 5% of global greenhouse emissions. And many of the products that come into our hospitals, as Dorota will speak about later, are hazardous, toxic, maybe carcinogenic, asthmogenic, endocrine disrupting chemicals, all of which we can either substitute for less toxic chemicals or manage those so that we're not exposing patients, workers, and communities. We're the second largest user of energy and water among commercial buildings. And as we all know, we have vast amounts of waste that we do not manage well, to the extent that the UN Special Rapporteur on climate, on hazardous waste, said that half the world's population was at risk from the mismanagement of healthcare waste. The Sustainable Health in Procurement Project, as you heard about this morning from Rosemary Kumwenda, is a project to integrate sustainability into criteria for the procurement of buying health products and services. This is a 4-year project for which we have 4 main goals: to set standards, universally adaptable criteria and standards. And Arianna is sitting on the expert advisory committee to develop the Sustainable Procurement Index for Health. And many thanks for your work there, Arianna. Then we will build capacity to implement those standards in fostering sustainable procurement in healthcare settings and with manufacturers of health products. That's the 3rd goal. And then last, of course, measuring our impact. And I'm going to show some of the examples of how we're making progress and measuring impact now in the 3rd year of this work together. Rosemary, I'm sure, shared with you the 10 countries, lower and middle income countries, and that are a part of this project, and that we are also in partnership through the Sustainable Procurement in the Health Sector group of UN agencies that are shown on the top right of the screen. There are 7 UN agencies and 3 global funding mechanisms that are working together also to integrate sustainability. And of course, through our Global Green and Healthy Hospitals network, where we're scaling up currently throughout Latin America and throughout Southeast Asia, in addition to the 10 countries. The next few slides are just examples of progress that has been made in the last 1.5 years as part of the SHIP project. We have new national policy that was developed in partnership between Healthcare Without Harm's partner, REEI, and the Ministry of Environmental Certification Center. This work has just been finalized and will be piloted in a number of hospitals later this year. In India, we have where the private sector is the largest proportion of health services. We have a national standard, a private sector standard for green hospitals that has a chapter on sustainable procurement. You can see the team from the Public Health Foundation of India on the stage at last year's Green Health Asia conference that was held in Singapore, as they're announcing that the next Green Health Asia conference will be held in Chennai in India. Looking now from national to subnational policy, we had an example with one hospital in the Free State of South Africa that started an initiative to eliminate the hazardous pesticides they were using, implemented an integrated pest management, and inspired the province to promulgate that policy throughout the province for all health institutions. And in the Western Cape, where Cape Town is, the Western Cape Department of Health made a commitment following participation in a SHIP meeting in a neighbor country, Zambia, where the director of procurement went back and revised the criteria for laundry and cleaning chemicals, integrating sustainability criteria that was informed by the Nordic Swan eco-label. So thanks for your continued work on the Nordic Swan policies that we share broadly and has been very useful to our colleagues in South Africa. Thinking more about subnational policy from SHIP, we have a policy in Cali, Colombia, the second largest city in the country, Colombia, in Latin America, that has eliminated the disposable cups and foodware in their cafeteria. They're having a difficult time right now, COVID, holding on to that commitment, but they are. And in Cundinamarca, which is the province of the capital of Colombia, Bogota, they have a provincial policy for sustainable procurement, which, as you can see on the slide, includes the criteria in infrastructure projects and in budgets of hospitals, so that they are in partnership between sustainability, procurement, and hospital directors and architects to integrate sustainability into their purchasing. This slide, while you can't read it unless you read Spanish, shows the progress made throughout Latin America and the hospital leaders who have received awards in the Menos Huella, Más Salud, Less Footprint, More Health project. And this shows over 2 years the progress people have made in committing to sustainable procurement, 75%, although 75% here are not monitoring the cost of the more sustainable and the proportion of sustainable chemicals by cost of procurement yet. 71% with committees, and they're following this on an annual basis to, again, as I said before, these are the award winners, and the awards has just closed for this year. The last hospital example is one from North America, from Kaiser Permanente, who has been a pioneer and leader for Practice Green Health, the US member of Global Green and Healthy Hospitals. And you can see their environmental stewardship goals by 2025 that include not only their goals that have an impact on their patient care services in terms of climate, food, waste reduction, and water conservation, but in addition, their products that they will meet their environmental standards by 2025 for at least 50% of their chemicals of concern list. And they're looking this total health image at how they collaborate with communities to reduce risks to food sheds and watersheds, reduce air pollution, and so that all of their environmental management meets international standards. Turning to the ever-present coronavirus that has had a huge impact on health systems globally, a huge impact on populations and economies globally, and on the ability of health institutions to continue to support and maintain their sustainability efforts. There has been a great impact on the supply chain. In recent weeks, we've been hearing both about how some facilities are paying more attention to sustainability and reusables when in identifying gaps in access to personal protective equipment, PPE. We're also seeing that there's an increased waste generated in COVID waste streams by up to 5 to 6 times per patient bed, and that's in part because they're not segregating the waste for treatment and reuse or recycling of those waste streams that are reusable, and a large overuse of disinfectants. You can see that we have a new paper out on beyond COVID-19, and you can find the link to that on this slide. The slides will be made available to you. A couple of the pieces of work that we have on our Healthcare Without Harm Coronavirus Resource Center is on healthcare waste management. And here you can see on the slide a picture of a large-scale autoclave for healthcare waste treatment. This is in Ghana. And this is work that's a public-private partnership where the public sector is using this facility, a private facility, for their waste treatment, using steam sterilization so that their waste can then be reprocessed or can be recycled and also landfilled. This top is an example. We discovered from our network in Latin America that there was a proliferation of disinfection tunnels. These are, for example, car washes that spray toxic disinfectants at human beings that was proliferating in markets, in parliaments, in Europe, and hospitals, and in train stations in Africa and in Latin America and Asia. And we collected the data from throughout our network and shared this with WHO, who then asked their poison centers and found that 8 countries were experiencing poisonings from the overuse of disinfectants. And WHO then published this myth buster that spraying or introducing bleach will not protect you against COVID-19. And many ministers of health have joined, including South Africa, Colombia, Malaysia, India, to say this is not a good idea, although it is still happening in some countries. The other place, antimicrobials are in excessive use, and this is an updated paper from Healthcare Without Harm on antimicrobials in hospital furnishings, and with this recommendation to avoid purchasing furnishings that contain antimicrobial technologies that are added for purposes other than product preservation without evidence that they're effective. Again, the marketers are pushing these products because of fear of infection without evidence of effectiveness and with much evidence of the risks associated to the health of humans who are either sitting babies in bassinets that have antimicrobials that are unnecessary. Last, I want to share with you the new guide that has been published just a month ago, Sustainable Procurement in Healthcare Guide. You can see quotes from a couple of our colleagues in South Africa. The sustainability, especially in procurement, has been discussed for public procurement, but not fully applied in healthcare settings. And this guide has step-by-step guide to empowering supply chain officials to mainstream sustainable procurement. As we move to the session on market transformation, this slide illustrates that how we work to transform the health sector will transform key markets, policy, and have an impact on shifting the entire global economy to be more sustainable. Stay tuned that there are a number of upcoming webinars and workshops online, excuse me, including Healthcare Without Harm and the Skoll Foundation having the second in a series of local solutions for global recovery. The launch of the Sustainable Health Procurement and Healthcare Guide in Spanish and Portuguese happens on the 29th of September. We have a virtual clean supply chains in response to COVID, October 14th, and Clean Med Europe on sustainable procurement in December 2nd. So many opportunities to gain further information and connect with your colleagues and network in this area. Thank you very much, and thank you again to Arianna and colleagues.
Thank you for your interesting presentation. I hope that by now who did not know how to start with the sustainable procurement can get inspired by this case study, sustainable procurement guide, and get to work. I remember to our participants that if you have any questions for Susan, please type them into the chat box and we will go through them at the end of this session. And talk to you a bit more about the European Healthcare Market Transformation Network and very briefly about our plastics and disinfectants projects. So I think that by now we all know that the amount of public spending for healthcare service in Europe and not only is quite large. So given its scale, we think that this sector can play a significant role in influencing markets because procurement can be a strategic opportunity for healthcare purchasers to achieve environmental and sustainable development objectives. So We have seen that many of our members, especially in the Nordic countries, they are already integrating sustainability criteria in their tenders or requests for information. But they also have the challenge to be a relatively small market. And some of them asked us to support this work by creating a platform where members can discuss, exchange their experiences, challenges, and best practice. At the same time, it can be burdensome for companies to see public authorities asking sustainability questions in their tenders, or asking for the same information but perhaps in slightly different ways. So this is why earlier this year we started to develop the European Healthcare Market Transformation Network as one of our main channels to leverage the sector's purchasing power. So in a nutshell, we aim to harness the economic influence of the sector to drive markets towards the supply of healthier and more sustainable products and services. And we want to do that through harmonized procurement standards, aggregating the demand and innovation and supply chain engagement and cooperation. So more into detail of how we were going to do that. At the beginning, when I designed the process, I imagined something like this, kind of clear, logical, and consequential process. First, we prioritize or choose the product we want to focus on. We recruit the working group members interested in working on these products. Then, together with them, we define the sustainability concerns that should be considered when setting up procurement demands, and we draft harmonized, sustainable procurement criteria that can be workable across country. Obviously, the best sustainable criteria are not very useful if you don't have suppliers that can meet your requirements. So a key phase of the process is to engage with the market. So we are creating a reference working group for companies to be part of it. And so as I said, one of the key steps is to indeed engage with the market, test the feasibility of the criteria, and therefore identify potential innovation gaps or unmet needs that could be met through innovative solutions. So this process will then result in standard sustainable procurement criteria that we want to make available on our website, and that our members can use in their procurement demands or requests for information, or at least that they can use in the market dialogue with their suppliers. So in the long term, the harmonization of sustainable procurement criteria will lead to an increased demand for sustainable products and give a clear signal to the market, and eventually also reduce the cost. Now, we are just the beginning of the process, but the more we dive into this type of work, and the more the process looks more something like this. So the process is still quite clear, but the preparation work, the market engagement, and the deployment of the harmonized criteria are more complex. And I took this graphic from another colleague working on innovation procurement. So I will not go through all these steps for the sake of time, but I will explain how we're using, or we say how we're integrating these activities into Healthcare Without Harm Europe pilot projects. The first project I'm presenting is called Towards Plastic-Free Healthcare in Europe. And it was launched in February this year, and it's supported by the Flotilla Foundation. The goal of this project is to reduce damage to human and environmental health from plastics used in European healthcare. So we're implementing the project with 8 of our members based in 6 countries, and together with them, we hope to identify opportunity to minimize the use of disposable plastics and replace them with safer alternatives. So ultimately, through this project, we would like to embed the circular economy model into healthcare practice. Our activities develop across 3 pillars, being them research, education, and innovation. We are therefore collecting more information about the categories and quantities of plastics that are used by the participating hospitals. And this step is crucial to support the product prioritization work needed for the healthcare market transformation network. So the third pillar of the project, in the third pillar, we want to stimulate innovation problem solving and mobilize the demand for sustainable plastic and packaging alternatives to transform the market. So basically what we did, we basically expanded the innovation pillar and opened to the other members that are open the group to other members that are not part of the plastic project, but that still want to work on the procurement criteria. We looked at the procurement data, and in agreement with the members, we decided to prioritize PPE. So we are now collecting and looking at the best practice on sustainable criteria for responsible purchasing of gloves, for example. We will start from gloves, but after that we look into other PPE. And we are also interviewing non-members and companies who have experience with this product. So at the end of this month, we will present the preliminary results in the working group call and decide how to move forwards after showing all the data collection and best practice of the criteria that we collected so far. So if you want to learn more about the next steps for the procurement of gloves, I encourage you to join the working group. It's still open. And then the second process, the second project we are taking advantage of is called SciCam 2.0. And its objective is to promote the use of more environmentally friendly disinfectants without compromising on hygienic and occupational health standards. And during this project, it's a 2 years project that started in 2018. So during this project, we analyzed the procurement practice of participating hospitals, looked at the hazard profile of the products that they use, and recommended options with a lower hazard profile. So building on the learnings from this project, we again expanded the expert working group that was steering the implementation of the project. We also invited some of the hospitals that participated into the hazard analysis and replied to the survey to be part of the working group. And then as I said, we invited them to be part of the healthcare market transformation and to work together with the other members that sign up to it. So far, we recruited the working group, prioritized the work on routine disinfectants. So for products such as hand hygiene products, not non-surgical scrubs, surface or instrument disinfectants. And we are also, again, learning from the best practice. In this case, in Sweden, we are preparing a step-by-step guide with useful criteria questions. And Dorota will tell you more about the Swedish experience and how we are building on that. Again, if you want to be part of this, I encourage you to register to the Healthcare Market Transformation Network. And of course, for us, it made sense to start from these projects and the learnings that we're gaining from these pilots. But the number of working groups are increasing, so we don't have a working group only on plastics or disinfectants. We plan to look at medical textile and waste. and we want to expand after 2020 with other key working group linked to our program areas and projects that we have at Healthcare Without Harm Europe. So in this table, you have a sort of recap of what is happening this year. Again, I would encourage you to get involved. The working groups are open to healthcare employees, public procurement professional, product expert academics, or representative from NGOs. If you are a company or if you belong to the private sector and would like to engage with procurers, I still encourage you to sign up and be part of the reference group. And with that, I conclude, and I now, without further ado, I'd like to give the word to Ollie, who will talk about replacing pressing packs with individual items bought in bulk.
Thanks, Arianna, and thanks, Susan, for sort of a good overall introduction. I'd like to say the graph you showed for the NHS, I don't think that's changed too much. I think it's still pharmaceuticals and medical devices at the top. I think waste is at the end, but I'll talk about that and why that might be the case. So I'm just going to share my screen. It's the first time I've done this, so bear with me. Share your entire screen. Yes. Great. Okay. So yeah, so we've been doing quite a lot of work on plastics. So I'm from a small community trust in Sussex in the south of England. And you may have heard of the sustainability work that we do. It's called Care Without Carbon. And we've been pushing on the sort of plastic agenda for the last couple of years, trying to get a bit of traction on what is sometimes a big scary sort of area, because there's so many moving parts and there's quite a lot to consider. So hopefully I can give you a sort of an overview about what we've done and some ideas about potentially what you can do in your own healthcare organisations as well. So just a bit about the trust that I work for. We employ about 5,000 people. We have those staff are quite spread out over about 113 different buildings, although we keep finding people in small offices in random places, which is quite interesting. So that number does change. We give care to over 9,000 people per day, and we cover a population of 1.3 million. So keeping our healthcare staff very, very busy. So Care Without Carbon, like I said, is our sort of program for sustainability. And to make it a bit easier to work with, we break it down into 7 key elements. So those are things like buildings. So that's looking at our energy, water, electricity, gas use, that kind of thing. We look at our journeys, so promoting active travel and electrification of transport. Circular economy is where we pick up both waste management and procurement. Culture is about engaging our staff and empowering them to be sustainable at work and operating in a sustainable way. And staff well-being is sort of focusing on making sure people are happy and healthy at work. As you can imagine, it makes a lot of sense for healthcare staff to be very happy and healthy. Otherwise, it seems a bit silly if they're not. So I just wanted to cover off what we mean by circular economy in healthcare when we talk about circular economy. It's a bit of a buzzword, those from a sustainability background, but it's not always explained sort of in detail or any kind of length. So I'm just going to give a really brief overview of what we mean by circular economy in healthcare. So this thing you see on the screen, the sort of linear flow of resources is what we've always been doing for the last over the last 100 years. So we extract natural resources, we create them into products, we distribute them to our health centres, and we use them typically once, and then we dispose of them. So this is the really important part of circular economy, is looking at this supply chain and understanding where are the environmental risks, but also the opportunities. So looking at that from an environmental perspective, but also from a social perspective, how are people being treated by creating and transporting and moving these products around? But also, you know, what's the kind of cost of this and the implications, and looking at this sort of linear set of principles. This has really been brought to the fore with the recent pandemic about security of supply. So can we get the natural resources and can we get the products that we need in order to deliver healthcare, and how do we maintain that over a long period of time? So that's really this recent pandemic has really brought those conversations to the front. So during this process of creating products and distributing them and extracting those materials and refining them, there's an enormous amount of energy in terms of fossil fuels or electrical energy, and labor, so human effort. People have really, people have sweated over extracting these resources and turning them into something that people can use. And with the current system, a lot of that energy and labor is lost. We either landfill it or we typically incinerate it. Most healthcare waste is incinerated at a high temperature to destroy any kind of harmful pathogens or pharmaceuticals that might be within the waste. If we're lucky, some of it might get sent to incineration with energy recovery, especially in the UK. Some of that energy might be recovered and exported to the electrical grid. But all of that energy and labor that was invested in that product in the first place is pretty much lost, is no use to us anymore. So really what we want to do is we want to loop those materials back into the system to be able to reuse them again. And whilst we're looping those, we want to make sure that those steps in the middle, the manufacturing of the product, the distribution of the product, and the use of that product is sustainable in itself. So we're manufacturing using renewable electricity. We're distributing it in electrical vehicles. We're really thinking about the whole life cycle of that project. So when I was mentioning about Susan's graph that showed the different NHS bits, waste is right at the end. Typically, it's not shown to have a very high carbon footprint. But what a lot of people don't consider is that's just the disposal of the waste. But if we look at waste as the end point in a supply chain, then you can really start peeling back the layers of this issue of you've invested so much energy and labor into this product and now you're just going to throw it away. So those conversations, by looking at the waste, the conversations of circular economy really come out. So I think that's a really interesting point to mention. So recycling sort of loops around and goes in just after the extraction stage and to the product manufacture stage, but you are basically breaking that material, that product, back down into its material components, and then you have to make a new product again. So the energy and labor from sort of that point onwards is kind of lost, and you have to start again. Redistribution is a bit better. So instead of recycling it, you may be redistributing it to other organizations, maybe schools or charities, that kind of thing. So again, you're saving some of that energy and labor that was put into that product. And then reuse, so reusing it internally within the organization, perhaps multiple times. That is the best sort of gold standard of using a product. But also, when that product is first created, we want to make sure it's created in a sustainable way. So that just kind of gives a bit of an overview. It may feel like just like a sort of a lesson on circular economy, but I think it's really important to kind of frame what we mean when we do talk about circular economy. And obviously, the most important part of that is to reduce the amount of resources we are extracting and producing, and I'll talk about that in a second. So a bit of inspiration that we had at Sussex Community was there's a really great organisation known as the Ellen MacArthur Foundation, and they really sort of push and promote circular economy thinking. They pretty much write the textbook of how to deliver circular economy and the benefits of that. So they produced this report a number of years ago called the New Plastics Economy. And it really looks at how, what we're trying to get towards. When we talk about, eliminating plastic or creating sustainable plastic products, what are we actually talking about? What are we trying to move towards? Because I think that isn't always framed very well. So they sort of break it down into, we need to eliminate the plastics that we don't need. We need to innovate to ensure the plastics that we do need are reusable, recyclable, or compostable. And we need to circulate. So what I was talking about, we need to, all the plastic items we use to keep them in the economy and out of the environment. So that was a bit of an inspiration for us looking through that. So one of the main things that we got started in, this kind of landed on my lap really, rather than me trying to find willing participants. They came to me. So we have a team in our organisation called Hospital at Home Team, and they deliver care to patients that have just come out of hospital and are in their homes. But the idea is to make sure that they feel supported at home. We can deliver some sort of basic care and make sure we keep them out of hospital, because really we don't want them in hospital. We want them at home, comfortable, but we're still able to sort of look out for them and then deliver care. So this is the team, very smiley, just on their e-bike there, that they use to go out to patients' homes. So they came to me one day and they were a bit exasperated with the amount of dressing packs that they were getting through. So they were using over about 30 dressing packs per day. So these are basically sort of small packages. You see there in the bottom right hand side, small packages of basically everything you need to do a dressing or to do any kind of clinical procedure you need to do in the home. Sort of basic IVs they were using it for, so intravenous work and that kind of stuff. So they were getting through so many. Marcello, the team leader, showed me sort of bin bags full of this stuff that they were using every day. And he said, there's got to be a better way of doing this. So we sat down and we looked at the different types of products that were in the pack. And in red, I've sort of highlighted all of those that are plastic within that pack. So you got things like a water repellent sterile sheet, examination gloves, polypropylene tray, polyethylene apron, and the reality of this, when people were using it, they were opening the pack, but half of the stuff would just go straight into the bin. Wasn't even needed. Maybe they only need one swab, but it's got 5 in there. Maybe that time they didn't actually need the sterile sheet for that particular thing they were doing, and that would go in the bin. So right at the beginning of using that pack, they were just throwing things away. You also had the extra packaging, so these all come in their own peel packs. So you've got a paper and a plastic cover, and there are sometimes just completely unnecessary items in there. So there's like a little tray, there's a little paper ruler that is never needed. There's often like a little waste bag when they would take their own bags with them as well. So all of this equipment, the community nurses actually have that equipment already. So we talked about, how can we eliminate the fact that we're wasting all this stuff, once we open the bag, and make it a bit more tailored to what you actually need. So what we looked at is moving towards sort of buying each of these items, but in bulk, in singular packs. So you can buy aprons on a roll. So you can buy 100 aprons on one roll, rather than having one sort of neatly packed in the bag. They already have boxes of gloves that they can use. So what they would do is they would literally they would either take a whole lot of this stuff in their car, so then they can take it off and take what they need into the patient's home, or they know beforehand what they're going to need for that day, so they can pack that into their car and take them with them. So they had already done a bit of innovation where some of our community teams would just pack up everything they needed for the day, and they would put that in a plastic bag, and they would take that to the patient's home. But this team had bought some sort of lightweight plastic containers with a lid, and they would take that into the patient's home, and then when they came out, they would disinfect that, they would wipe it down, and they would then be able to reuse that again and again instead of just going through loads and loads of plastic bags. So in order to cut down the amount of items that they were using, one thing we did, like I said, was to move to single items, but also what the team wanted to do was change the way they deliver care to reduce the amount of items they were using as well. So to draw up all the necessary drugs for the IV, it was written into the policy that they needed to wear gloves, but the clinical team felt like that was something that they wanted to be optional. I think the reason that it was originally brought in is because some, if there was a spillage of the pharmaceutical, some clinical staff may have a reaction to that pharmaceutical, and they would have got sort of skin conditions. But in reality, the team was very happy. There was a very low risk of not using gloves to prepare before going over to the patient. And also the technique that they were using was a non-touch technique. So a lot of this stuff didn't actually need to be sterile, and they didn't need so much PPE to actually deliver the stuff, because they're not actually touching the patient, but they were still wearing all the PPE. So we partnered with our infection control team. We got them involved, and we rewrote the trust policy to reduce the amount of sort of PPE or items they would need to deliver the necessary care. So we really made progress with this. The team really adopted it, and we haven't actually been able to sort of calculate the sort of waste, tons of waste savings or the cost savings, but some very rough calculations from our IV team lead suggested that there were quite significant financial savings from going to sort of singular items, because the dressing packs are about 40 pence each just to buy, where in reality, if you were using sort of singular items, then that is far less in cost. But that was the tip of the iceberg, it seems, because when we were looking at our procurement data in a lot more detail, we discovered that dressing packs are actually one of the most frequently purchased things that we buy. So in 2019-20 financial year, we purchased 132,000 dressing packs. So there is more work for us to do, unfortunately, but I think we've developed a bit of a model by working with the hospital at home team as to how we can shift away from that and make it a bit easier and safer for staff to deliver care in a way that they're comfortable with, and whilst providing sort of savings, environmental and economical savings. So that's just a bit it for dressing packs. We also did a bit of staff engagement. So we have green champions or sort of carbon champions, whatever you want to call them, in our organisation, and we developed a bit of a toolkit for them to talk about in their team meetings with other staff, and to really engage people with let's talk about plastic at home and how you deal with that at home. So are you trying to reduce your plastic at home, but also how you would do that at work as well. And we had a few case studies in there about what people could do and what other people have done to reduce their plastic use. So we produced a bit of toolkit on that front that they could use, and we also created a pledge. We call them dares. The dare was to use one less piece of plastic, and we had 125 members of staff sign up to use one less piece of plastic in their workplace. So this sort of two-pronged approach of working with procurement and working with clinical teams whilst engaging staff was really kind of beneficial to opening up that discussion on plastic in the organisation. So recently we've done a bit more work looking at our glove use. As Arianna mentioned, we're part of a Healthcare Without Harm project trying to reduce the amount of plastics that we are using. And gloves is the top of our hit list at the moment. And as you can imagine, it's very well talked about in the media. But it wasn't until we started actually looking at our glove use in the organisation that we really understood the issues of what was happening. So from doing a bit of digging, it didn't take very long, we established that sort of the global picture was that there is really only 3 or 4 large manufacturers of clinical gloves in the world. Most of that is in Malaysia or China, and there are sort of 3 main types used within healthcare. So you've got nitrile, which is like a synthetic rubber. You've got vinyl, which is more of a plastic, and both of those are made from fossil fuels. Although the actual looking back at the supply chain and how they are manufactured does get a bit complicated unless you know your chemistry. So maybe Dorota knows a lot more about how that all works. And then you've got latex, which is essentially from a rubber tree. So as you can see in the bottom left there, you've got these large plantations of rubber trees that often are in Malaysia and take up sort of large areas of land with just the same tree, but biodiversity is very low, and you're just using that to produce rubber. So that is the other option for the natural thing. So 2 different forms of production, but also they both have their own environmental risks and impacts. So for our trust, when we started looking, we realized that we before COVID, it's important to state that this is before COVID. We haven't looked at our use during the pandemic, which we imagine will be a lot higher. We used 4.3 million gloves in the last financial year. So that was a bit of a shock for a small community trust, realizing that. And what was really interesting was the breakdown of the different types we were using. So 53% of the gloves that we were using were actually vinyl gloves, and 47% were vinyl, whereas I was under the impression that we were mostly using nitrile, and a lot of other healthcare organisations in the UK do mostly use nitrile. And when reading about the different types of gloves, that I did find several sources that said vinyl, and it was quoting directly that vinyl was not appropriate for reducing infection risk, which was a bit shocking to see, the fact that we were using quite a lot of them. I don't know how sort of warranted that is, but yeah, that was interesting to uncover. So we were buying, I said there was sort of 4 or 5 manufacturers globally, but we were buying from sort of 7 different suppliers, which we kind of trace back to those larger manufacturers. And then those 7 suppliers then have 19 different brands, and then you've got 90 different products if you include the different sizes as well. So what looks like quite an open and diverse market is actually quite limited when you follow that funnel back to the back of the supply chain. So Great Ormond Street, sort of looking at what we can do about this and the sort of risks and opportunities within sort of glove use. There is a really good example in the UK from Great Ormond Street Children's Hospital, who did a gloves off campaign to reduce the amount of gloves that they used within their organisation, and in a very short space of time, they managed to save 21 tons of plastic from reducing their glove use, and they saved about £90,000 or 100,000 euros in costs. So that is something that we are going to be doing in our organisation about appropriate glove use. We've had conversations about that and how we're going to do that. So that's on our little checklist of things to do. We want to highlight the risks and opportunities in our current supply chain. I've talked about a few of them already. So environmental, economical, and social. Just to pick up on that social one, there was a really interesting news report from Channel 4 News in the UK about the conditions of producing the gloves in Malaysia by certain manufacturers. And I encourage you to go and watch that to look at some of the issues in the supply chain. I'm not saying that the gloves that we have bought have definitely come from these factories, because we don't know, but it really sort of highlights the risks and the concerns from this supply chain that we need to be very aware of. And sort of finally on our checklist, I think what we need to do is, after we've reduced the gloves as much as we can, we really need to reduce the carbon intensity of the gloves that we're actually buying. And that is building on some of the work that Arianna has already mentioned, by putting in strong sustainability criteria for manufacturers and working with manufacturers to reduce the environmental impacts of their production. And you see I've got reuse and recycle on there, which a lot of people might be shocked to hear when we're talking about gloves. But I really think there is room for innovation beyond gloves, if we think about, what can we use instead of gloves, but also what we do with that material once we're done with it, in terms of recycling. So really encourage that kind of that discussion around that. So we're doing quite a lot of work as well on top of this. I don't know how I fit it all into my day, but we are doing a bunch of other stuff relating to plastic as well. So I won't cover that now because I want to leave time for some interesting questions. So that's about it. Thanks for your time, and I'll hand over back to Arianna.
Thank you very much, Oliver, also for showing all the data about gloves that we have been collecting also with the other hospitals. It is very, very interesting and shocking indeed. We don't have a lot of time left, because we have 22 minutes before automatically being kicked out of the room. So I give over to Dorota, and Dorota, let you start the presentation.
Okay. So well, first of all, I must say again that it's a great pity that Anders cannot present his work and his team himself, but I will do my best to guide you to the slide he prepared. It will be basically a feedback on the experience of procurement of disinfectants from the region Västra Götaland, which is located in west-south of Swedish coast, and which oversees delivery of different kinds of products to 19 hospitals, 100 of primary and dental care centers, as well as other public institutions like schools, museums, etc. When it comes to disinfectants, I think it's really important to emphasize that disinfectants are the part of daily routine in hospitals. So they are used every day in the time of pandemic and outside of time of pandemic. And they are a special kind of products. They are essentials one. They have to be used to prevent contamination, cross-contamination, outbreak of infections and diseases. But at the same time, they contain active biocidal substances which can pose a serious risk to human. They can be carcinogenic, mutagenic, and reprotoxic. They can show the endocrine disrupting properties. They can be also very toxic to aquatic life. Towards substitution of disinfectants that the most harmful to the most safe that exists, there are a couple of factors that has to be considered. And then basically, when purchasing the disinfectants, the first thing in the, let's say, hierarchy of criteria that has to be considered, it's their antimicrobial efficacy. So basically, they have to be efficient. They have to work. They have to fulfill the work. They do the job they are have to do, and this efficacy should be high enough, and that can be evidenced by passing the well-established standard tests. But at the same time, disinfectants we are looking for, they should have as low as possible occupational health impact. They should have as low as possible environmental impact. And of course, they should have affordable price to keep the costs under the control. So it's actually really important to address all these factors in the procurement and to follow up on them carefully. Just very short feedback on the COVID-19. Well, we all know that the use of disinfectants increased dramatically, and not only in the healthcare, in all other sectors, the public life, in our private households, etc. Unfortunately, the price also increased, which actually is still, even if the initial lack of disinfectants in healthcare is now, well, let's say the problem is solved and they are available. Unfortunately, the price still stayed much higher, and that actually creates extra negative impact on the healthcare and negative pressure on the healthcare functioning. Also, what can be seen that some new disinfectants with different quality and unknown properties are also appearing on the market. And this is why it's very important to emphasize that it's really important to keep on, quality control and to stick to the health environmental demands on disinfectants to avoid future problems. Okay, so actually, basically, I covered these ones, I suppose. I already mentioned the impact of, okay, so that's, I think, the slide I should continue. There are two separate procurement disinfectants in region Västra Götaland. One is focusing on products for disinfection for skin and surfaces. So in skin, for skin, that means products for hand disinfection, and also the patient skin disinfection. Surfaces, that can be any other surface like desk, benches, beds, etc. And the other stream of procurement is focusing on medical equipment, which includes sensitive surfaces, more invasive equipment, endoscopes, probes, etc. However, this presentation will focus on the group, the first group, so procurement of disinfectants for skin and surfaces. It is important to know that this procurement includes disinfectants, and that means for different, when disinfectants for surfaces includes different products for different surfaces. This is also, there are different disinfectants for skin, for using on skin, so they can be just, the hand sanitizers, but also more specialized disinfectants, as I mentioned, to clean the skin of the patient, for example, before the operation. And then when together with providing these disinfectants, the procurement is also providing soap and skin lubricants. And this is important also because the soap is used regularly hundreds of times, but sometimes per day. And it's important that it should be as mild as possible to simply protect the skin of the employees. And skin lubricants are used both for patients and as for the staff. Then procurement was supported by the special multidisciplinary group of experts, which included project leader specialized in procurement in all the legal aspects of procurement, also chemists, that's actually Anders, as well hygiene experts, hematology experts, and finally important group, so personal people who are using these products, because that's normally this is the group who is really well reporting back any problems. Most often there are problems with skin, so this is also why procurement team is actually also working really closely with occupational health service, trying to ensure that the products used are really as human-friendly as possible. And all this group, all these experts, so this group is created to really ensure this. This disinfectants are not only efficient, so they not only kill the microbes they have to kill, but they are as safe as possible, also as environmental friendly as possible. This is something I closed. For the sustainability demands, the procurement is supported by the National Agency for Public Procurement, which created the website. So this is what you can see is actually this the screenshot of the website. It's fortunately in English, so everybody is very much invited to check it. And basically then the most important thing is that through using this wizard, you can use this tool who will guide you through the process and help you to make the right choices when planning the procurement of disinfectants. So just very briefly to go through this process. First, if you click the tool will start, you can choose the product area, and if you see actually there are much more products than just the disinfectants, which will be covered by cleaning and chemicals. And then you also, for going further, you will can choose the level, let's say, of your demand. It means basically that you can choose the basic level, but you can also increase your demands to the spearhead. And the higher of course, the level of your level of your demands, then the more criteria, the more hard criteria will be also chosen. Once you choose the level, you will be also guided through different information. So what kind of technical specification, what kind of chemicals and hazard you should avoid. This is just the example, for example, so you should also not, in case of human hazard, you should avoid respiratory and skin sensitization. That will be guided by the specific number that should be also delivered with the product. And going even further, you will be also supported with information on how you can verify the demands for you. So when you follow up on the procurement, so what kind of labels, what kind of information can basically provide the evidence that the manufacturer is indeed providing the product you are asking for. Very important step in improving the procurement of disinfectants was the creation of a so-called National Substitution Group, which is a network between different regions and universities, and it's an excellent platform to share good examples of chemical substitution and examples and experiences, and really important that not only good but also bad ones are shared, so you can also avoid the regrettable purchases and substitution. And that's also makes possible to harmonize the demands, sustainability demands in procurement, to scale them up, and then in the end through the scale up procurement demands, you can really influence the market. And I know from Anders, he said it a couple of times that when he's really looking back what was on the market 10 years ago and what is now, it's clear that the products, disinfecting products, are better and more environmental and human friendly. Important thing also not to forget is that the procurement should talk to suppliers. It's really important and appreciated to have face-to-face meeting. Maybe not now really possible, but that helps a lot. Important is also something that is not well maybe provided with the typical safety data sheet, but you can also have the separate request for information, so you can ask more information than provided with any product. And also important, you are asking the suppliers the questions, but you should also create some kind of like tool that you also are able to make possible for manufacturers to approach you and to ask the questions and to support them also in the whole process. So those are actually two last slides with showing some concrete experiences. So when all this process is basically happens after a couple of years of doing purchasing of disinfectants in the region of Västra Götaland, basically now at the moment the main disinfectants used is alcohol, and ethanol is preferred to propanol due to less toxicity it shows. Chlorine is only used when really necessary, and outbreak like COVID can be also this exemption. And one of the product that is used recently, bigger amounts of accelerated hydrogen peroxide. There are clearly some no's. In none of the hospitals, the disinfectants are used in sprays. This is mainly related to the fact that aerosols are more dangerous and have more risk to cause the respiratory diseases and irritation. No perfume there. The interference are not necessary. Mostly they cause more problem, and they don't have anything to do with the work of disinfectant. There is also the limited of some PHMB. It's kind of complicated chemical. And basically, there are really no use of quaternary ammonium compounds, except of very few products, so it still is, but this is again more like exception than the rule. And then as also the procurement is really avoiding to use any unnecessary antimicrobials, and that mainly is nanosilver in this case. So some experiences to summarize. When you do the procurement of disinfectants, it's really important to ask for the list of ingredients, because remember that the safety data sheets, it's not providing all the information. Manufacturers mainly provide the information about the chemicals that they are obligated to report, but very often there are many others. Follow up on the tenders, so really check if all your demands are really fulfilled. Again, the very important lesson is to learn from others, share experiences. It helps a lot and speeds up the process and avoids many regrettable substitutions and purchases. The harmonizing demand is helping in market transformation, and dialogue with suppliers is also supporting market transformation, and it's also really helping to maybe understand better what is happening to the market. More quickly you can spot new, maybe better products. And then the three last points, it's more really like repeating on the best practice. So use the right disinfectants for the right purpose, use the right quantity of disinfectants. Mind the importance of skincare, and above all, always follow the hygiene routines. And so I thank you for your attention, and thank you very much, Anders, for preparing this presentation. Here is the email that I know that Anders basically is willing to answer any questions that may appear, and maybe we won't have time to respond, and he's definitely the best person to ask the questions regarding this presentation. Thank you.
Thank you very much, Dorota, for covering Anders' slides and jumping in last minute. We don't have a lot of time for the question, just more than 1 minute, but so that Susan already answered one of the questions that we had in the chat box. Maybe Susan, would you like to share a bit more with the about your answer.
Thank you, Arianna. And yes, I did put the link to the guide to the use of eco-labels for health products and services in the chat. Within the Sustainable Procurement and Healthcare Guide, we have a step-by-step approach where looking first at healthcare without harm and practice green health criteria to implement, and then to look to see if there's reputable eco-labels. And within the guide, it talks about how to define a type 1, 2, or 3 eco-label as defined by the ISO standard 20,400 for sustainable procurement.
Great, excellent for sharing this information with the rest of the audience. We don't have more time. We will be kicked out in 30 seconds. But if you have any additional questions, you can find us in the Dear Room programs with the speakers. So please get in touch with us and have a good rest of your day. Bye now.